and evening news at 6.
All right, well, as of 1:45 this afternoon, there are zero ICU beds available in the southern Illinois region, and it's just one more complication in the fight against COVID-19. Aaron Herman is the manager of the Hospital Coordinating Center in the southern region. He is joining us now to tell us a little bit more about this. Happy to talk to you. Hello.
Well, good evening.
Okay, so just last week we started really reporting on the lack of ICU beds, and it does not seem to be getting any better in southern Illinois. Some crews are working 18-hour shifts, I'm told. So how is the area managing right now? What are you guys doing?
Well, we've been doing a few things. We've been working very closely with the state of Illinois to get additional surge staff into the region. So far, we've had 29 additional healthcare professionals mobilized. We're expecting about another 120 to arrive in the next few days.
Okay.
And so far, that's allowed us to open up about 6 additional ICU beds across the region.
6 additional?
We've also been given a special waiver from the federal government to be able to move civilian patients into the 3 VA hospitals that border our region.
Okay, so do you think that's going to be enough? You said, what, 6 additional ICU beds, if I heard you correctly? Is that going to be enough?
That is not going to be enough. Last week, at one point, we had 34 patients who were being held in local emergency rooms while they were waiting for beds to become available throughout the region. Many of those patients have then had to be transferred as far away as Indianapolis and Nashville while awaiting their continuing care.
Yeah, it's such a tough situation, and then you hear of nurses and staff having to work 18-hour shifts just to keep things going. That's a lot on them. I want to ask you, talk about the problem a little bit more. What do you think is causing some of this shortage? We can't help but look at the vaccination numbers in southern Illinois. Is it your understanding and your feeling that that's part of the problem right now?
Oh, certainly. We've been very involved with the fight to try to get more people across our region vaccinated. Currently, we're sitting at 37.79% of our eligible population being fully vaccinated. But there's certain pockets throughout our 23-county service area, such as Alexander County, that are still at about 17% fully vaccinated. So that's certainly a problem.
Yeah, so a lot is being done to address the issue of the lack of ICU beds, but how much is being done to address this vaccination issue?
Education. We've been working very closely with our Healthcare Coalition and our many community partners just to try to dispel all of the disinformation that is out there, and try to give people the opportunity to hear clear, concise messaging and to get the facts to help them make a more informed decision.
All right, Aaron Herman, we hope things get better. We appreciate your time.
Thank you very much.
Okay, and still ahead here this afternoon, a quarterback could not